So we are here today with our patient Linda, and she initially came in to see me with left-sided shoulder pain. So what we're going to do today is kind of break down what we've been doing for her and give you an idea why chiropractic adjustments are great, but you have to address the root causes, which often is related to the soft tissue components. Now, the root causes can differ from patient to patient, different causes, etc. But the problem is if the joints are restricted, we have to find out why. It doesn't do any good just to keep adjusting the joints and have the patient come back year after year, visit after visit, week after week, and they're not actually progressing in their treatment. So that's what we did with Linda, and what we found is that she actually had an injury. So she had a shoulder injury, and so her left side, her levator scapula, her trapezius, and her rhomboids, and the entire shoulder, actually, the shoulder capsule and the rotator cuff muscles were all very tight. There was a lot of hypertonicity involved, and there was some fibrosis due to the injury, and so the chronic defense mechanisms that were occurring. So what we've been doing with Linda, in addition to adjusting, is actually addressing the soft tissue components. So with her, we have a muscle known as the levator scapula. And now the levator scapula on the spine model, you can see, runs from the top of your shoulder blade all the way up to your neck, actually. All the way up to the first or the third cervical vertebrae on the side of them, on the transverse process is what's known as. So not only did she have some issues down here, she was also having issues up here near the suboccipital muscles of the neck. So this muscle runs all the way up the back of your shoulder blade all the way to your neck. So what we've been doing in addition to adjustments, as we said, is some specific techniques to release this muscle underneath its active and passive ranges of motion. Now we're able to do this technique for both the muscles up here as well as the upper trapezius muscles as well as the rotator cuff muscles to get optimal results. And this is why, as you can see, can you show us your range of motion where you were when you first came in? So she was about here when she first came in. And since we've been working on these structures, this has only been the 5th visit. Now she's where at? Can you show us her range of motion now? So she's dramatically improved. Now Linda saw chiropractors before, and all they did was adjust her, and she was not seeing, she obviously felt immediate relief, but it wasn't consistent, and the results weren't consistent, so the problem kept coming back. She also saw physical therapy, and what we see with physical therapy is while physical therapy can be good, what we see most often is if there's an injury and the muscles are already tight or hypertonic, if you're going to be exercising those muscles, well, you can make the condition worse. So we didn't want to do any exercise with Linda. What we want to first do is stabilize the muscles, start to relax them so that they're able to not be on the defense all the time. We want to make sure that she's healing properly. Then once she has proper range of motion in all of her tissues, then we can start rehabbing the muscles back to where they should be with proper form. So that's why we're getting such great results with not only Linda, but a number of our patients in such a short amount of time, because we're really identifying not just her symptoms, but also the root causes of her symptoms. So we really want to look at where these issues are coming from. So I hope this video helped you a little bit. You can get an idea of what's going on. Linda's been a great patient so far, and so we will talk to you soon.